Good afternoon. My name is Marcel Arbuckle, and I'd like to welcome you to the Partnership for a Drug-Free Detroit's monthly broadcast. I am the Executive Director of the Center for Urban Youth and Family Development, and the Center for Urban Youth and Family Development is a 501c3 nonprofit public charity that provides substance abuse prevention for youth that are in and transitioning out of the foster care system, as well as other services. And I have with us today Mr. Matthew Yescult, and Mr. Yescult is from Taylor Teens. And tell us a little bit about yourself.
Yeah, I am a community organizer, director with Taylor Substance Abuse Prevention Task Force. I am also advocacy chair with Michigan Prevention Association. I am a licensed pharmacy technician, and I am a peer review board member of the Pharmacy Technician University.
Oh, fantastic.
Well, thank you for having me today.
All right. Well, we're very, very pleased to have you. And if you're not aware, the Partnership for a Drug-Free Detroit is made up of those 35 substance abuse prevention, treatment, and recovery providers that are funded through the Detroit Wayne Mental Health Authority. And we're here today just to talk a little bit about some of the factors that are impacting the city of Detroit and metropolitan Detroit and the county of Wayne relative to substance abuse. And I guess one of the key topics that we want to address a little bit today is that burning issue that is going to impact most of the citizens across this great state, and that is the legalization of marijuana for recreational use vote that will be coming up in the next few months in this coming November in 2018. And so with Matthew being the advocacy chair of the Michigan Prevention Association, he has become a bit of an expert on the topic. And the Partnership for Drug-Free Detroit obviously stands as opposed to the legislation to legalize marijuana for recreational use. And we want to just talk about and try and bring some clarification to some of the myths and misunderstandings that are surrounding this vote and this legislation. I think first of all we want to clarify the fact that it does not impact the already passed legislation for the use of marijuana for medical use, for medical marijuana. And you want to talk about that a little bit, Matthew?
Yeah, that's correct. Absolutely. There's going to be no impact for medical marijuana. Medical marijuana regulation was put in place when Michigan voters decided in 2008 that the state should have the right to use marijuana for medicinal purposes. So that would be dispensaries can now open. There was regulation that's put into place through LARA and through the Bureau of Medical Marijuana Regulation, and they've continued to regulate. And this proposed bill that was put forth and received enough signatures by the Coalition to Regulate Marijuana Like Alcohol, their goal being much similar as to what's said in their name, will not affect medical marijuana regulation.
Okay, and the use of marijuana for recreational purposes has been passed in 5 states. I think the first and the one state that we have the most data and results for is the state of Colorado. And we find that in Colorado, just to go over some of the impacts that have been resulting from 2008, is that traffic fatalities involving operators testing positive for marijuana have increased 100%. The majority of driving under the influence of drugs arrests involved marijuana, and 25 to 40% were marijuana alone. Toxicology reports with positive marijuana results for driving under the influence have increased 16%.
And Marcel, let me stop you right there. There's still been issues in Michigan that have been occurring with marijuana intoxication. The MSP, Michigan State Police, has recently rolled out a program for oral swab testing. It's a field test on the side of the road, and it's implemented only in certain counties right now. But this is because of the prevalence of drug-impaired driving that we've been seeing.
Right.
And it frightens me to think of the increase that's happening in Colorado and how that could affect the state of Michigan.
Absolutely. And then to go away from the traffic use and look at the impact on youth, they found that youth ages 12 to 17 were considered current marijuana users at 10.5% of that population, as compared to only 7% nationally, and that Colorado ranked fourth in the nation and was 39% higher than the national average for youth using marijuana. And then they also found that drug-related suspensions and expulsions from high school increased 32%, and also the vast majority were marijuana violations. So you can see that it is having an impact on the young people that reside in the state, and not only the young adults, but then the adults. That the percentage of college-age students ages 18 to 25 years old were considered current marijuana users. That was up to 27%, whereas it was compared to only 18% nationally, and that Colorado ranked third in the nation and was 42% higher than the national average. So it's not only affecting the young adults, but as the youth as well.
I'd like to go back to the school systems for a moment. There's a quote that really shook me that came out of Colorado. One of the superintendents from one of the biggest school systems in Colorado said, to preface this, it was proposed in Colorado's legislation that all the money from, similar to Michigan lottery, right?
Yes.
All the money from legalization was going to be going to the school systems, was going to be helping their roads. You know, none of my roads are brought to me by Michigan lottery,
right,
or certainly the alcohol industry either. And this quote that was said by the superintendent in the school said,
well, a lot of that money is being redirected to other purposes, just like emergency room visits. In Colorado, there was a 57% increase in marijuana-related emergency room visits after the legalization. Hospitalizations related to marijuana have increased 82% from 2008. And the city of Denver rate for marijuana-related emergency room visits was 45% higher than the rate over the rest of the state of Colorado, because Denver is a place where you have a lot of tourist activity, and people are literally coming into town for the purpose of testing the marijuana and sampling it and finding that it is having an impact on their health, and also therefore an impact on the medical system. And a lot of the funds that they thought that would be available from the tax revenue are having to be diverted for traffic enforcement and medical uses.
Mm-hmm. Yeah, marijuana tourism was thought to be something that would bring a lot of money into Colorado,
right,
when really it's the black market too. People are going into Colorado purchasing great amounts of marijuana and then bringing it to states where it's not legal to make an illegal profit off of this legal marijuana.
Well, just on that note alone, diversion of Colorado marijuana, highway intersection seizures of the Colorado marijuana destined to 40 other states increased 397% from 2008 to 2013. And the average pounds of Colorado marijuana seized destined for other states increased 33.5% from 2008 to 2009 compared to 2005 to 2006. So yes, the black market is definitely rolling and very happy about the legalization. And then,
let me stop you there too. Mm-hmm. I've heard stories from Michigan State Police that come to the table and report to us that this is happening in Michigan right now with currently what we have with the medical programs that are in place, that people are coming in with medical cards from other states, purchasing marijuana in our state with those other state medical cards, which is illegal, but still being allowed in some instances, and then trafficking that vast amount of marijuana to other states as well.
Well, you know what? Shockingly enough, the U.S. Postal Service has been impacted by this. In fact, U.S. mail parceled interceptions with Colorado marijuana destined for 33 other states increased 1,280% from 2010 to 2013. Is that crazy?
That's
1,280% of people, an increase in the amount of marijuana interceptions by the U.S. Postal Service. And in fact, U.S. mail pounds of Colorado marijuana seized, destined for those 33 other states, increased by 762% from 2010 to 2013. So that's crazy.
Yeah, not the kind of reputation we'd like to see
Right.
Michigan having either, that we'd be able to, or be caught sending marijuana across our
Right.
borders.
Right. It's absolutely crazy. And then, you know,
You know, with
when,
with
go ahead.
businesses, you know, talking about the post office and the USPS kind of made me start thinking about businesses and how this really impacts a lot of local Michigan businesses as well. And there was a case that came out of Colorado. It was a Dish Network case where a Dish Network employee was terminated because he tested positive for marijuana.
Right.
Dish Network had a policy that said, well, we can terminate any employee at any time that fails a drug screen. This employee took it to their Supreme Court, all the way costing Dish Network tons of money to fight this case, and it still was deemed, you know, state law.
Right.
Federal law surpasses state law, so it was rightful for that termination. But a lot of businesses should be worried about this as well, how it's going to impact their drug screening policies.
Well,
how it's
not
gonna
only their
impact
drugs,
hiring rates.
yeah, their hiring rates as well. And you know, Walmart recently had a case very similar, and they were able to win. But once again, it cost them a ton of money to represent themselves and to establish the fact that they had the right to determine whether or not an employee could be employed by them that used marijuana, even though that employee had medical requirements to use marijuana. So those are issues that employers are going to have to face. And you know, we recently did a survey with Wayne State University, and one of the questions that we asked on our survey is, would you be okay if your bus driver had just used marijuana before coming to work? Would you be
Wow.
okay with your nurse having just smoked marijuana before coming on shift and you were under her care? These are some of the issues that we have to bring into perspective of reality as we look at this legislation. One other area that I think I'd like to address is this notion of decriminalization. And we are finding that in the urban community like Detroit and other urban populations, that there has been a cry or a call to decriminalize marijuana because it would then help reduce the statistics on the number of young African American and Hispanic people that are being arrested for selling marijuana on the street. Well, that has turned out to be absolutely just the opposite
Right.
in Colorado, and in fact, there was about a 12% increase in the number of arrests of young African American males for selling marijuana. And what they found out is that the recreational marijuana was actually fueling and providing supply for these young people who would then take it, break it down, repackage it, and sell it to underage buyers.
So coincidentally, decriminalization and how Colorado thought they would do it really just created more of a health disparity for ethnic minorities.
Absolutely.
And yeah,
And then not only that, just overall crime in Denver increased 6.7% from the first 6 months of 2013 to the first 6 months of 2014. The number of pets poisoned from ingesting marijuana has
my
increased fourfold in the past 6 years. Colorado estimates for annual revenue from the sale of recreational marijuana varies from 65 million, or 0.6% of all the expected general revenue, to 118%. So no matter, 118 million. So people have this perception that there's going to be this big impact on the budget, but even at $118 million worth of sales, that is only 1.2% of the Colorado state budget.
Right.
So this great windfall of cash that they was expected to occur never has occurred. And when you look at it in total perspective to the overall budget in the state of Colorado, it's a pittance. It's a drop in a bucket.
Yeah.
It's 1%. And then most of that money, or a vast majority of those funds, are being cannibalized by law enforcement for traffic violations and other criminal activity, and then also from the state's emergency medical funds for emergency room visits and things of that nature. It's
Going
impacting
back into
the
prevention and treatment for youth as well, of course, yeah. I mean, we don't see, like we said earlier, any roads brought to you by Gold, or I don't know, alcohol companies. Grey Goose?
No.
Right? There's no Grey Goose
Absolutely
Avenue around here. But, you know, that money really isn't going back into what people think it'll go back into.
Yeah.
And
So, just to shift for a moment, tell us a little bit about the work that goes on at Taylor Teen and the work that you do there.
Sure, absolutely. Taylor Teen Health Center is a Beaumont-funded teen health center. We offer services to youth, youth from the ages of 14 until 21 can get full gen med services, and then we have family planning services actually from 14 until there's no age gap for those services also. Youth can come in, 100% confidential visits, and get any needs that they may have. We don't turn people away.
Fantastic. And then your work with the Michigan Prevention Association, give us a little bit of background about that.
Yeah, so the Michigan Prevention Association is an advocacy group of business professionals and prevention professionals coming together and taking stances on big important topics such as marijuana legislation that we're talking about today.
And I know that the Michigan Prevention Association is currently working with a gentleman by the name of Scott Greenleaf.
Yes.
And he has a coalition that he has developed to be the opponent to the legalization of marijuana. Are you familiar with his work? And
So on November 27th, the Healthy and Productive Michigan formed, and this is a coalition that is uniting and taking a stance and lobbying against the marijuana legislation right now. So yes, it is fantastic. It's good to see finally against all these billboards that you may have seen in your communities, and have certainly terrified me to see that we have someone who is going to stand up against this.
That's great.
A statewide effort as well.
And yeah, and he has an organized statewide effort that will be providing the direction and I guess the leadership to oppose this legislation. And what's the name of it again?
It's Healthy and Productive Michigan.
Healthy and Productive Michigan, and I believe they have a website and a Facebook page that they've already established. And one of the amusing things that Scott has been mentioning is the fact that he has been getting some very negative feedback from individuals that have the misperception that this legislation and this vote will have an impact on the medical marijuana. And as you indicated, that was already passed in 2008. And even though here we are 9 years later and we haven't quite figured out the methodology for the dispensaries, and we're still in the process of trying to figure out the zoning and things of that nature, and that's just for the medical marijuana. Can you imagine the complexity of trying to figure out the recreational use? And I go back to the organization saying regulate marijuana just like we do alcohol. And right now I think we're doing somewhat of a poor job on our regulation of alcohol when you consider the fact that young people have to pass 2 and 3 liquor stores to get to their high school.
Oh, absolutely.
Walking down the main fairways here in the city of Detroit, and those are some of the things that we're trying to work out right now. And I just don't think that we want to throw marijuana in the mix, even though we already have the issue of the dispensaries and here in Wayne County, the work that's being done to regulate them and so forth. So
to go back and clarify really quick too on how you talked about people having that misconception that this legislation will take away from the medical side, kind of think about like a pharmaceutical drug such as Norco. And Norco you need a prescription for, you need a doctor to say it's clinically justifiable for you to use this medication. Let's assume for a minute that there were legislature out there that said Norco can now be accessed by anyone, and we're going to open up shops that'll just sell Norco. You can go in and buy it. It wouldn't change how I would still go about getting a prescription. It's just I could also go to a shop to purchase that Norco as well. So that's kind of like what we're looking at right now, saying that marijuana is a medicine, and now we're thinking about taking this medicine and making it available for anyone who wants to use this medicine.
Right, and I think that's a great segue to just touch on for a few moments one other issue that I'm sure you're on top of in both your positions with Taylor Teen and with the Michigan Prevention Association, and that is the opioid epidemic that we're facing here in our nation, not only here in Michigan and Wayne County, but across the entire nation. And do you have any comments or feedback you'd like to give in that regard?
Absolutely. I think, and I'm going to segue a little bit back to marijuana as well, that marijuana is in fact a gateway drug, and that we need to acknowledge that marijuana is a gateway drug, that it primes the brain. A youth mind that is exposed to a chemical, a mood-altering substance at the age of any age under 25 is still a developing brain, that we're reinforcing that pathway, and the brain is going to be learning addiction. So the brain of a marijuana user is going to have enhanced responses for more primed. It's priming the brain for enhanced responses to opioid drugs.
Right.
So someone who used marijuana is so much more likely to become a victim of this terrible crisis that we're in today. And I hope and pray that we don't have to face any more opioid deaths. And the way that we're in the crisis right now is in 1997, I believe it was, Purdue Pharma made a drug called OxyContin.
Yes.
And this drug was marketed to doctors, and the marketing scheme was fantastic. Marketed to doctors as a safer alternative to Vicodin, which was out there at that time.
Right.
And doctors bought into that because the mechanism is a little bit different, and started to prescribe much more OxyContin at the time. And now, obviously, the federal government caught on, and other agencies caught on about what an issue OxyContin addiction became. They began to limit the amount of OxyContin prescriptions, but the demand was already there.
Right.
We just took the supply away.
Yeah.
So when we take the supply away, what's going to flood the market but heroin?
There you go. And I think that those issues are things that we're going to continue to face if we don't have a strategic plan on how we're going to manage those issues and develop some type of coordination on how we're going to control those substances and make sure that our streets and our cities are safe for our youth and for everyone else. And one of the things that we want to really point out and leave with our audience, if we can't leave anything else, is that a teenage mind, the brain of a teenager, is not fully developed. In fact, science has now taught us that the human brain does not become fully developed until around the age 24 and 25. And we've also have scientific data and research that verifies the fact that the use of marijuana by teenagers does have a negative impact on their ability to learn, their ability to have good memory and things of that nature. And if we can't do anything else, we really need to eliminate this notion that it's okay for teenagers to utilize it. And just like we don't want our teenagers to utilize alcohol until they're at the age of 21, we really need to drive home and stress the fact that we don't want our teenagers using marijuana. And on that note, I give it to you to give some shout outs to your friends over at Taylor Teen and so forth.
Yeah. Shout out to Taylor Teen, to all my fantastic coworkers, to my beautiful wife, Jessica, and Miles, his second Christmas this year.
Fantastic.
Love you guys.
Fantastic. And I'll do the same as we sign off. We want to let everybody know that recovery does work, that prevention is effective, and that treatment is also effective. And you can reach out for help across the city of Detroit and across Wayne County by contacting the Detroit Wayne Mental Health Authority. And we also want everybody to have a great holiday, a safe holiday, and we all bind together to make sure that we have a partnership for a drug-free Detroit. Thank you a lot.
Marcel, yeah.
I appreciate having you on.
Thanks for having me.
And we look forward to continuing to work with you in the future.
Absolutely.
All righty. Thank
Yep,
you so
thanks
much.
again.
And everybody have a great and a safe holiday, and also have a sober one.
Yes. Happy holidays, everyone.